administer a toll-free helpline, and produce award-winning educational and digital resources that reach more than 1 million people each year. We also conduct cutting-edge research on the emotional, psychological, and financial journey of cancer patients, and advocate at all levels of government for policies to help individuals whose lives have been disrupted by cancer. In honor of National Family Caregivers Month this November, we are excited to offer this 4-part webinar series for cancer caregivers. We recognize the important role you play in the life of your loved one and joys and challenges you may face as you navigate your caregiving experience. We sincerely thank you for taking the time to join us today and for the invaluable and instrumental care you provide. Now, it is my pleasure to introduce our presenter, Dr. Tamryn Gray. She is an instructor in medicine at Harvard Medical School within the Department of Psychosocial Oncology and Palliative Care at Dana-Farber Cancer Institute and the Department of Medicine at Brigham and Women's Hospital. Dr. Gray is a health services and palliative care researcher who employs mixed methods, big data, and implementation science to investigate the complex medical, decisional, psychosocial, and socioepidemiological factors influencing care delivery and health outcomes for patients with serious illness and their caregivers. She is particularly interested in developing solutions that spur health system and policy changes to leverage patient, family-centered care, palliative care, and care transitions as innovation points to improve health outcomes, health equity, quality, and costs. Now, without further ado, Dr. Tamryn Gray.
Thank you so much for that wonderful introduction, Audrey. And I must say that sounds like such a mouthful, that bio. I am honored to be here today. It is my privilege to present on this very important topic of the role of family caregivers as patient advocates engaging with healthcare teams. In terms of disclosures, I am a part of the AARP Public Policy Institute with a particular focus, working group that focuses on long-term services and supports. I'm also a researcher, so I have grant funding from the Robert Wood Johnson Foundation as well as the Cambia Health Foundation for my work in family caregiver research. And another disclaimer, I do have an 80-pound puppy who may come into the scene, who may bark, but we'll keep going and rolling with it if he does. Okay, in terms of the presentation today, I'll be providing a brief background about the topic. What do we mean when we say caregivers? What do we mean when we talk about advocacy? And then I'll provide kind of an overview of the really explicit objectives that we'll discuss, followed by examples of what it means to be an advocate in healthcare settings, social services, and legal settings. I will also discuss the benefits of caregiver advocacy on patient outcomes, as well as strategies to become an effective advocate. And lastly, we'll conclude with discussing facilitators and barriers to the caregiver role as patient advocates. So by way of background, this work is incredibly meaningful to me. I think it's no better time to discuss family caregivers and advocacy than now as we are approaching the holidays, as we are getting to be around loved ones. And for some of us, that may mean being with loved ones in the hospital or other healthcare settings. So I'm grateful to be here, and just to kind of provide some level setting, I want to define what is a family caregiver. And these are really individuals who provide care that is typically uncompensated and usually in the home care or outpatient settings. Caregivers provide a significant amount of time and energy, months to years, and requires the performance of tasks that typically are done by nurses, by healthcare professionals, nurses, doctors, social workers, etc. Family caregivers, as many of you all know, tackle physical concerns that patients have, but also emotional, social, and financial needs. And family caregivers, they often spend, this first picture here is an empty wallet. They often spend a lot of their own resources for their role, especially financially. And as we mentioned earlier, with the care that's being transitioned from inpatient to outpatient, family caregivers are playing an essential role in the healthcare system nowadays. And a lot of times with family caregivers, it is a role that you did not necessarily happily volunteer for. But it does require a lot of time and devotion and commitment to the ones that you're caring for. So supporting family caregivers is an urgent public health issue. Part of my background as an epidemiologist as well as a nurse is really understanding the bigger picture issues of the healthcare system. And what we know from an epidemiological standpoint is that there are around 53 million people who provide a broad range of assistance to support the health, quality of life, and independence of a person close to them who needs assistance as they age or have a disability or have an acute or chronic health condition. There are millions of adults and people with disabilities who would not be able to live in their communities without this essential support. And oftentimes caregivers are sacrificing a lot just for providing care for others as they fill in the gaps in between care settings. And the resource below really provides the link to the report that recently came out in September from Health and Human Services that really is one of the first of its kind that outlines national strategies to support family caregivers. And in this report, they really provided an amazing job with really explaining how critical caregivers are to the healthcare system and to public health in general. So I'm a peds nurse by training, so I always like to really provide some visuals to help people understand different concepts. And this picture here really, I think, just outlines it pretty accurately in terms of what is a family caregiver. How do they feel sometimes? As a family caregiver myself, sometimes it feels like you're kind of receiving all this information from a fire hydrant. And that means in terms of information that the team provides, information that the patient provides, and you're also just trying to juggle things as a human being in general. So I like to really kind of convey this slide just as a reminder that family caregivers are typically overwhelmed while still appreciating their role. They may have times in which they're stressed and need extra support. So this slide just really talks about the significant impact that caregivers have on the healthcare system. These are just some examples, and this is certainly not the exhaustive list, but caregivers provide assistance when it comes to providing meals, transportation, mobility, being present in the doctor's offices during visits, taking in information with the patient. They often accompany them on long admission stays. And they also monitor at home too, in terms of symptoms and medications, providing emotional support, even help with grooming and dressing and bathing. They also help to provide just opportunities for patients to feel like they are able to stay in their own home, stay in their own environment around the people who are there to support them. So I love this graphics because it really shows the diverse profile of caregivers in the US today. The one thing that we won't be talking a lot about in this particular session, but I'd be remiss if I did not share it, is that caregivers save the healthcare system a tremendous amount of money, over $470 billion annually. Caregivers really do help to save the system money when it comes to providing care for loved ones at home. So that was just a background about who family caregivers are. What are we going to be discussing today? Well, today we'll be describing their role as patient advocates and understanding how their role can really impact patient outcomes. We'll also be identifying strategies for family caregivers to effectively communicate and partner with patients and healthcare professionals. And then, as I mentioned earlier, we'll be defining facilitators and barriers to the caregiving role as patient advocates. So here, this slide really provides the many ways in which caregivers can serve as patient advocates. And what do we mean by being a patient advocate is something more, the concept of patient advocacy is something more and more hospitals are becoming receptive to. Hospitals are seeing the primary caregiver and other family members as having a really positive impact on the level of care, helping preventing problems, medical errors, unnecessary transitions, and unnecessary readmissions. But in turn, sometimes family members find themselves feeling more like a visitor than actually a part of the care team. But patient advocacy is really one of the most important roles that family members, particularly family caregivers, can have, because this essentially means that they're speaking up on the patient's behalf and engaging with the healthcare team to determine what care really aligns with patients' preferences, goals, and values. So here on this slide, there are many ways in which caregivers can be advocates. When they are present with family members at hospital visits, they're taking notes. They're asking follow-up questions until they understand. They're accompanying patients, and it could be more than one individual who are there. It could be more than one family caregiver who's present. So they have a network oftentimes around them. They also are engaging with patients in the way in which they're providing remnants of home. If the patients are in the hospital, providing pictures and mementos and flowers and books and things that remind them of home. Caregivers also play a role in terms of monitoring symptoms and side effects of treatments and medications. They're often on the phone for sometimes hours at a time, following up after visits. And they're often providing a lot of love and support in the community in which the patient resides. Other times, caregivers are advocating by way of electronic medical records or kind of virtual platforms that allow them to communicate directly with the care team via text message or via the EHR portals. They're also sending emails to many people aside from the care team, insurance, payers, social services, etc. And all the while trying to be strong for the patient and trying to just help them to be able to get through this really tough time. So there are many settings in which caregivers can be advocates. One setting includes the healthcare setting, which is often the really common one that we would often expect. But there are other areas in which caregivers can be advocates, including within the realms of social services and legal settings. So we'll talk about that in a moment. But first, I wanted to draw your attention to this article here, which really is a study that talks about how family caregivers often feel like they're advocates, especially for older adults in residential aid settings. This is a fairly recent article, and I thought it just provided a great, just really brief layout on what it means to be an advocate. And in a nutshell, what it describes is how family caregivers often help to hold the organizations accountable by making sure the information is transparent and safe and equitable and aligned with the patient's wishes. And they're also really essential when it comes to communication, when it comes to all matters related to the healthcare and medical jargon. And they're also really important. The article also describes caregivers as being essential when it comes to connecting with many different types of people, many layers of the system, and also having a profound trust that is felt by the patient. Oftentimes patients choose that one person or a few people in their circle, social circle, who would be appropriate advocates for them. And a lot of that is due to the trust that they feel for those individuals. So defining an advocate, this here provides examples on what it means, kind of a visual pictograph on what it means to be an advocate in more detail. So first, as we talked about, having an individual that is known as a trusted individual, one that takes notes and provides records, knows how to stay organized with all of the paperwork, knows how to ask questions to who and when. They also assist in finding resources for the patients, clarifying information, mediating disagreements, whether that's disagreements within families or within healthcare teams and the patient. They also ensure compassionate, respectful, and high quality care. They want what's best for the patient. They know how to communicate with the team. And also they're involved in decision making. And most importantly, they stand up for the patient. They're not making decisions for the patient, but they are in particularly focused on what would the patient want in this situation if they're unable to, or if they, to speak for themselves, or if they feel unheard. So I want to pause for a moment here and really ask, thank you so much, Gara, what resonates with you on this list? Please type it in the chat. And what is particularly missing? What's missing on this slide that you have experienced as an advocate, or that you may want to just share with our community here today? And I'll read some of those out loud. So I'll give you a moment to think about ways in which you've advocated for close family members and friends, and then we can see. Thank you so much, Dawn. Yes, I often like, so Dawn says, it really resonates when it comes to assist in finding resources for the patient. We often have to be true navigators and hunters, and knowing how to navigate so many different resources on the internet, in person. So thank you so much, Dawn. And Laura says, I don't know if, let's see here. Okay. I don't know if this is right, but missing is the emotional support. Absolutely. Thank you so much. Yes, emotional support is so important. And then coordinating of care and communicating with various providers. Thank you so much for that, Lori. We often have patients who have more than one health condition. All of us have more than one health condition. So there is a lot of kind of relaying back and forth pieces. I like to think of us as puzzle solvers. We like to put different pieces, we have to put different pieces together in order to get the full picture. Having more tools and resources, yes. Taking notes, reviewing medical details, tracking progress. Thank you so much. These are just wonderful comments, and I so appreciate your involvement in the chat. End of life care, absolutely. And reporting back. Oh, yes, Mary, that is such a great one. So as a family caregiver myself, I provide distance caregiving to my father, and there is a lot of information being relayed to other family members. Sometimes you're kind of the tunnel for other individuals. And also, Dawn, helping patients communicate with the care team. Absolutely. Especially if they may have cognitive impairment, if they may have language barriers, if they may have kind of different health literacy levels. All of these are important factors, but important, essential factors in making sure that patients do feel like they can communicate, because their voice is essential. These are fabulous. Thank you all so much. So as I alluded to, there are many different types of settings. Healthcare is the obvious one, but there's also social services and legal settings. So when we think about healthcare in particular, we'll start from the left to the right. Being an advocate for patients in the healthcare setting means often being a part of shared decision-making, being a part of discussions, family meetings, ways, and these discussions are often, they often are held at the beginning of diagnosis, at the beginning of a hospital admission, at the beginning of a new treatment plan or new medication, when there's different routes in which you may want to, the patient has to choose whether they want an intensive care or want to focus on quality of life at the end of life. And there's also a situation, not just shared decision making, but when the patient is unable to speak for themselves, we often see caregivers being advocates when they have to speak on behalf of those individuals. Also, as we talked about earlier, asking questions, clarifying questions, being present, being not present, being on the phone, not being physically present, but being on the phone, providing video conversation with the care team. Another thing is companionship. Sometimes when we've all been patients, so when we're often in the hospital by ourselves, it's nice to have company, especially people who know us. And that's the role of family caregivers as well when they're serving as advocates. They're being present, they're sitting, they may not have to really say a whole lot. If it's a really tough day, they're there with the patient, providing that emotional support as was mentioned in the chat. Nutrition or not. And what I mean by that is whether they want an IV, if they want nutrition through an IV. Oh, my internet is unstable. 1 second. Okay. If they want nutrition through an IV, if they want nutrition through a G tube, through an NG tube, all of these things are really tough decision points. And it's important for the caregiver to understand what the patient really wants in that setting. What does it mean to have good quality of life when we're talking about nutrition and the patient can't eat? Other examples when it comes to being an advocate in healthcare settings include having discussions about long-term care, home health care, hospice, and also managing symptoms, understanding suffering. Suffering is a very kind of intense feeling that patients may have because a diagnosis can change their life. It can change their normal routine. And when caregivers are really considering the patient's suffering, they know how to really advocate for the patient for their well-being. Also, it means understanding how alert the patient wants to be if the condition progresses. What is their comfort level? What do they prefer in terms of pain management? Do they want pain medications? Do they not? What kind of pain medications? What are they allergic to? What have they tried before? And then one important piece is also having an understanding of the patient's preference for organ and tissue donation. So those are just some examples. I think I'm just getting tired just thinking about that. Whew. The other types of settings for advocacy is social services. Now, this is something that I've really become really interested in because I like to think that when patients are diagnosed, it's not just the medical condition that is their the center of their world. It could be things related to their job. They may really care about their house. They may really care about people around them. It's not, sometimes the medical condition is secondary to things such as survival. So that's why it's really important to remember your role, if you're a caregiver, your role as an advocate in the social settings. And this can include having discussions and coming up with true solutions related to transportation services. Who's going to pick up the patient if they need to be seen in the PT clinic and dermatology and wound care? How are we going to get them to these places? What kind of vehicle is a little two-door car isn't going to help someone who needs to be in a wheelchair? So, how do we advocate for appropriate transportation services for the patient? And also childcare. Not all of our patients are elderly. We have patients who are also parents, who are also caring for other dependents. So as a caregiver, we have to think, okay, what should we do with the child and other individuals who are impacted by this patient's health condition or hospital stay? And also their work. How can we advocate for helping the patients construct a letter for their employer for time off? And then economic stability in general. If the patient's going to be out of work, what role does the caregiver have in terms of helping them to get supplemental financial resources in the meantime? And then safe housing. This is really important, especially when we think about individual patients who are victims of abuse, patients who are homeless. The role as caregivers is to really understand what does it mean to have safe housing after the person is discharged, or when the person has 4 flights of steps, they all of a sudden cannot go back home. They may have to go to a loved one's home that's on like a first floor level or a main level with no extra stairs. So what does it mean to have safe housing for patients? Also medical and insurance billing. That is very tedious. And caregivers are learning a lot as they go in terms of medical and insurance billing, but it's critical, especially when you're thinking about the gaps in coverage. And then food services and home health and nursing home placements. These are all other examples as well. And how do we advocate for Meals on Wheels or neighbors, organize and assembly neighbors to come and drop off meals? How do we think about safety concerns when it comes to the patient when they're in the hospital and not at the hospital, when they're back at home? So there's a lot of concerns when it comes to social services and a lot of ways in which caregivers can be advocates in that arena. And then the other setting is the legal setting. Yes. Thank you so much, Cecilia. And we can get to that in the Q&A. That is critical. In their care, are the patients facing any types of discrimination or biases from the healthcare team. Pause, my internet has been stable. I'll pause. Okay. And also HIPAA and other restrictive laws. How can caregivers get information about the patient, the information that they need to know in order to make decisions? And also when we think about neglect and abuse, these are all legal issues when we think about elder abuse, child abuse, and you're a caregiver and you're taking care of someone who's gone through those experiences. And then the last thing, that legal settings include estate planning. This is something that's not discussed often enough because the person's in the hospital or the person's really sick at the time at home. But when we think about the future, these are types of discussions that should be brought up, and the family members should play a role in advocating for what's best. What does the patient want at that time? And also, when it comes to legal settings, I also want to put in kind of a brief plug for advanced care planning and advanced directives. With my work in palliative care, we are very much focused on optimizing quality of life throughout the illness trajectory, not just at end of life. So really focusing on family involvement, symptom management, prognostic understanding. But with that, we also advocate for advanced care planning. And this is something that caregivers can also advocate for. And this is just a process of conversations that helps you determine what medical treatments you will want in an unexpected event, what patients will want in an unexpected event. And really thinking about all the different layers when it comes to medical options, treatment options, housing options, who's going to take care of individuals when they get sick. And this is different from an advanced directive. An advanced directive is a legal document that really allows you to choose the patient advocate. So having that documented as a designation of patient advocacy is incredibly important. Oftentimes in families of color in particular, this document isn't completed and often put in the EHR. And it's important to understand cultural reasons for why certain patients and families do not fill out advanced directives. It could be because it feels final, because it feels like you can't change it, because it feels like we're saying that the person's going to die tomorrow or the person's not going to get better. So it's really important for us as caregivers to understand what is an advanced directive, what is advanced care planning, and just normalizing that conversation so there'll be less stress when things are really at a really tough place for patients health-wise. So next we're going to talk about caregiver advocacy and patient outcomes. So I threw out a ton of information in terms of what it means to be a caregiver advocate, a patient advocate as a caregiver. But I also want to talk about what are the benefits to this for patients, for families, etc. One of the unique things that is often not discussed when we think about advocacy is that we're really bringing in people who know the patients best into the fold, into the care team, caregivers, family members, people who know them as human beings, people who know them before they got sick. And one of the benefits of advocacy is that we're leveraging inherent strengths found within families and communities. This is an important point to remember because although family members may not be experts every time with every medical condition and every medication, they know their community, they know the person, they know the person's background, they know their prior experiences with the healthcare system, and they know what inner and inherent strength lies within their community. And they're able to really bring that forward when it comes to advocacy. Next, it allows for deeper understanding and acknowledgement of patient needs. And really, advocacy allows for a pause. It's almost as if the family members and caregivers are saying, let's pause, let's wait. Is this what the patient wants? Is this what they have, do they understand? Also, are you, as a caregiver, you may say, are you talking to the patient? Asking the clinicians, are you talking to the patient? Don't just talk to me. Talk to the patient, see them in the bed, see them in the chair. So it ensures that the patient's voice is being heard. It also, being an advocate really helps patients because sometimes patients hear things in a better way from family members and individuals who are close to them when it comes to all of the medical information and what it means on their life. So advocacy really allows the introduction of medical information and terms in a way that the patient can understand to make informed care decisions. It also reduces the likelihood of medical errors and improves quality of life. In some hospitals, family caregivers are able to advocate for things such as code blue and other kind of emergency activation systems. And also they're able to kind of identify when people like patient experience officers are needed, or when a meeting with the whole team is needed in order to reduce errors and maintain quality care. And one of the big things, we talked about this before, is that being an advocate means that you are having a presence in someone's life. And that alone helps to reduce the patient's stress because they don't have to figure it all out themselves. And it can improve satisfaction with care, which is something that administrators would definitely care about as well. And then finally, being an advocate helps to improve patient outcomes by building and improving communication, effective communication and rapport, as well as enhancing patient and family engagement. There's a lot of focus on patient family-centered care now in healthcare settings, because we know that patients oftentimes do not come in by themselves. So with having advocates around, we're actually able to improve their overall experience and engaging individuals who have a point of view that's often well appreciated by the care team. So strategies to become an effective advocate. So this is just a really simple slide, but one thing to think about prior to becoming an advocate, if someone were to say, I want you to be my advocate if I have to go to the hospital or if I get really sick, these are some things you should think about and know about beforehand. The first is to be self-aware, is to understand who you are, what you bring in terms of your knowledge, your experiences, your compassion for the individual, and your readiness and availability. Understanding, is this an appropriate choice at this time? Am I the right person? So that's what it means to be self-aware. Secondly, as we're going clockwise, leveraging your strengths and experiences. Can you do that? Do you feel you're in a position to do that? Do you feel confident to be able to speak up, using everything in your toolbox? And then additionally, prior to becoming an advocate, it's important to ask, can you reach out for support? Do you have that ability? Reach out for support, or reach out. And what I mean by support is for yourself as well as for the patient that you are the care recipient. Do you have that kind of those abilities to research information, find out information for the patients, for their needs, for your own needs? Because being an advocate, you want to maintain your well-being as well. And then also, can you listen and can you stay informed? Can you stay organized? Can you keep up with all the information that's often coming from the fire hydrant? Can you listen to the patient? Because being an advocate is not making decisions for the patient without their input. It's really about thinking about their well-being. So do you have that ability to really actively listen to what it is that they want and relaying that message to keep the patient's best interests in mind? So as we kind of wrap up, just a few more slides, because I'm really looking forward to the Q&A. Oftentimes we wonder what questions, what are example questions to ask? And there are great resources online. You can see the links below. But I will say, let's start with the pinning on first. Let's look there and kind of see. There are so many topics when it comes to being a caregiver and being an advocate for patients that that require attention. So first, being an advocate, you want to think about symptoms. You want to think about diagnoses. You want to think about medications. Thinking about diet and exercise as well. So it's not just about the medical condition, it's about the other things. It's about future planning, financial concerns, different tests that the patient has to go through, different surgeries, different follow-up instructions, discharge instructions, and when to come back in for the next visit or who to follow up with after a visit. So these are just some examples of topics that are pretty common when it comes to being an advocate. So what do you ask? Not being afraid to speak up and recognizing that you are a part of the team is essential. As a nurse, as a researcher, I strongly advocate for you to speak up for your loved one, because sometimes you may be the only one who can do it as well as you can. So some general questions that you may want to ask when you're accompanying the patient is, if they're having a discussion about treatment plans, what is the added benefit of this? What are possible side effects? Will it affect the patient's ability to function independently? How will the illness impact quality of life? What are the possibilities if I choose not to do this? What preparation is needed? Do you, as an example, do you have to take time off? Does the patient have to take time off? Is that having to think, a few weeks in advance before a particular procedure? And also thinking, are these tests necessary? What the results mean? What is the average recovery time? And when you ask a question like that, what it does is it helps you as a caregiver think, have a little bit more insight into what's coming ahead. That way you can share with the patient. Now, remember, you may not feel well the first few days. You may be in the bed. The doctor said that over time you'll be able to eat regularly or move about regularly. So even that question alone helps you and prepares you for conversations that could happen when it's just you and the patient. And then an important question nowadays is, am I allowed to visit? At the height of the pandemic, as we all know, family members were really limited in their ability to visit. So just asking a simple question about, am I allowed to visit? Am I allowed to accompany post-operatively? What are the other options when it comes to treatment? Is there any written information that we can take home? Or if you're an auditory learner, if the patient's an auditory learner or visual learner, those are things to really think about when it comes to learning preferences. And then what costs can we expect? What can we do to reduce cost? And if you think of questions later, how can we contact you? So all those are just example questions that you may want to keep handy as you're having discussions with the team and even discussions with the patient. And suggested referrals. Interestingly, I've been a nurse for almost 15 years, and I've primarily worked in pediatrics, as I mentioned, but I also have done work with adults, particularly with cancer and undergoing bone marrow transplant. And I have learned the important and essential role of family members from day one of a patient's care. And a lot of times family members, although they're present for long periods of times, they may not know about some of these extra resources that are available to them in the healthcare settings that are listed here on this slide. So if you feel that the patient is having pain and symptom issues, distress, concerns with the future, this kind of concerns with understanding their diagnosis or their prognosis, asking about the palliative care team would be helpful. Palliative care teams are also helpful if you are trying to figure out, how do you have a really tough conversation with the patient? For example, if it's a 14-year-old who is getting her leg amputated due to an illness, how do you have that? You may wonder, how do you have that discussion with that patient? And needing an extra layer of support from the palliative care team may be helpful. The pain team, oftentimes many healthcare facilities have pain teams that come and provide expert advice on pain management, as well as the emergency response teams, which are there for emergency situations. There's also patient experience officers. They may be named different things in different places, but they're also present to really make sure the patients and families are satisfied with care, if there are any concerns that they may be able to address. And social work and case managers and discharge nurses are also important, and individuals you may not see without a referral. You may not see them as common or as expected as you would like. But they are absolutely great tools. Thank you so much for that, Dawn. Yes, they are absolutely great tools. And they can help with emotional support as well as practical support, which, as I mentioned earlier, sometimes the practical support supersedes the medical concerns and emotional concerns. Sometimes they just are trying to figure out, how do I get food on the table after this admission. And then patient and family advisory councils. These are teams often within hospital settings that comprises the patients and family members who have had loved ones who have been ill oftentimes. And what they do is they really think about the growing needs and concerns that patients and families may have in the settings where they are. So they volunteer their insight to care teams and clinicians, which is really invaluable. And it helps us as clinicians to see the bigger picture of what patients and families may be going through. But also, family navigators or counselors are resource managers. They may be called different things, but these professionals are expert in helping to overcome financial concerns. And then finally, family support teams and medical interpreter services. These are individuals who also have great insight into community resources, as well as ways in which you can really receive information in the language that is most preferred by the patient. So just critical, yes, and caregiver support. Oh, thank you so much, Laura. Yes, chaplains, dietitians, speech therapists. And that actually reminds me, are there any other referrals? And thank you all for putting them in the chat. Are there any other referrals or questions that you think we are missing here? And we can also open up for the Q&A. So I'll let you all think about it and we can talk about it in the Q&A. And then finally, I want to close with facilitators and barriers. So what helps you become a great advocate? Well, having positive relationships with the other care team members is helpful. Recognizing the patient's need, being self-determined in the way that you know that you can make a difference, possessing individual knowledge and skills, and staying informed about the patient's care and their progress. And then also societal norms and expectations. Sometimes those can be a facilitator or a hindrance to your role. And then being open-minded, recognizing that things fluctuate all the time, and just being able to kind of adapt accordingly. When it comes to challenges, there are several challenges that could play a role when you're serving as an advocate. So for example, if you perceive powerlessness, or if you lack self-efficacy, this may not be the ideal role for you. Also, if you are lacking support, you can't do it all, and you should not do it all by yourself. So just kind of recognizing without extra support, it may be difficult because you need respite yourself. And if there's a complex interpersonal relationships between you and the patient, that may be a difficult dynamic to overcome. If there are restrictive laws or regulations when it comes to family engagement or privacy issues, that can also impact your role as an advocate, as well as code of ethics. And then, motivation and dedication. If you're maybe lacking motivation or dedication in your role, or lacking empathy, all of those factors can really impact your ability to be an advocate. As well as if you have compromised organizational skills or ineffective and limited communication skills, those would really play a role in really your ability to be a great advocate. And then also, if you may have a paternalistic perspective when it comes to healthcare, meaning whatever the care team, whatever the physician says will do, that may be really challenging because you may not be the one to challenge the care team or bring up different perspectives to the care team. And then finally, if you have insufficient time to engage, if you have so many other responsibilities, those are all, that is another reason why it may be a challenge to be an effective advocate. So I'm going to pause there, and we have a lot of great dialogue in the chat, and I'm really looking forward to our conversation. So I will pause and turn it over to Kara, perhaps.
Absolutely. Thank you so much, Dr. Gray. If we definitely have time for questions, so please, if there is anything you would like to ask Dr. Gray, don't be shy. You can put it in the chat or in the Q&A as well, and we'll yeah, just have time for a couple questions here. And Dr. Guy, I don't know if you saw, but there were definitely a bunch of folks that put in other support teams that they've utilized in that chat as well.
Absolutely. Thank you so much, Dawn, for sharing your story about your parents. And I definitely agree, social workers are essential. And then finally, let me see here. Oh, and then Mary and Laura, great references to caregiver support groups. You know, and asking about those things. I often find in my research with family caregivers, they don't want to inconvenience the team. They don't feel like they're the ones who are sick, so they shouldn't ask for help. But knowing the resources, whether it's virtual or in person, caregiver support services is essential. Having those support groups is essential. And then chaplains, dietitians, speech therapists, absolutely. And then occupational therapists, yes, helping them to kind of go back to a level of functioning is so important after an illness. And thank you so much, Rachel, for your Rachel Lisa, for your comments on elderly callers and the helpline. Are there any other questions that you all typically ask if you're an advocate for someone who's in the hospital? Are there any other questions that you all normally pose to the care team?
Dr. Gray, we have one question in that Q&A, actually two, so I'm gonna read them out loud to everyone. So the first one is, thank you for a great presentation. I'm wondering if you could speak to how to navigate less than positive relationships caregivers have with healthcare teams, particularly after a caregiver has asked some follow-up questions, i.e., why is this test necessary, and gotten a negative response.
Yes. Thank you so much for that question. And I have definitely seen both. I've definitely seen this in the clinical area where, so the onus, quite frankly, is on the care team, is on the health system. We need to be more comfortable and more accepting of family members asking these questions. I think when it comes to when there's a negative response to questions that you may have about a loved one's care, it's not the time to leave. I'll say that it's not the time to stop asking questions. So I'll say that first. But it may be the time to talk with a trusted member of the care team, whether it's anyone that you trust in the patient's care team, and talking to them about that exchange. And if you don't feel comfortable with that, I think first starting with a trusted member of the care team is important. Someone who's particularly outside, a little bit distant at first, to really share your concerns. And then it may have to go a little bit higher up from there. And it could be talking with folks who are helpful in communicating or having tough conversations, tough communication, like the palliative care team, patient experience officers, social workers. But also know that you're there for the patient. When I was teaching nursing students, I always shared with them two goals that I want them to have with every semester, which is to learn how to advocate for patients and learn how to advocate for themselves. So recognizing that you do have a voice is important, not shutting down, of course, not being irate, but knowing the different channels of communication and people that you can go to in the system to improve that experience for the patient. And also I would say, writing it down, having a notebook, writing it down, because sometimes it may not just be a negative response, it could be a conflicting response to what you have heard 2 days prior by someone else. So any of those less than positive experiences, I would say, make sure you vocalize your concerns and remind the team that we're all serving the same purpose, which is to be cheerleaders for the patient. But the patient is the quarterback. They're the ones telling us which way to go, oftentimes in terms of what they care about, what's important to them. But the rest of us are cheerleaders, and we need to work together. So that would be my brief response. But it definitely depends on the context, I understand.
Wonderful. Thank you so much. The next question in the Q&A is, you talked about many ways in which caregivers can advocate for the individuals they're caring for. Do you have any suggestions on ways that caregivers can better advocate for themselves, such as in getting self-care?
Yes. Lovely question. Lovely question. So I recently published an article in Health Affairs that talked about caregivers or patients who are also caregivers. And that's an important concept to understand, because you have individuals who come in to a visit to see their doctor, but sometimes their doctor may not know that they're also a caregiver. And with that comes a whole host of responsibilities and other stressors that should be discussed with their own healthcare provider. So, I'll say boundary setting is just such a critical way to maintain yourself through this process. Because if we have the caregiver in the hospital setting, we're going to end up with twice as many patients as what we had before if caregivers aren't able to maintain their own well-being and sense of balance and mission in their own life. So boundary setting, for example, you may say, I'm going to visit or take care of this loved one 3 days out of this week. The other 2 going to be dedicated to either my hobbies or my family. The other day is going to be focused on my health. I think just parsing out, and that's when it comes to not just having a calendar with the patient's follow-up visits and appointments, but also having time built in for you in that schedule as well, and not feel guilty about it. There will be ways in which you may feel guilty, you may feel pressured by the patient or by other family members that you're not doing enough, but just know that you're preserving yourself in order to be fully present with the one that you're taking care of. So I would say boundary setting and being organized when it comes to looking at your calendar and seeing how much you're devoting time for yourself. And that may mean doing nothing, or it could be meaning going for your own follow-up annual wellness visit. And then also talking to other caregivers, getting a sense of what they have tried, recognizing that what they have done may not work for you or may not be ideal for you. But really kind of talking with other caregivers who are in similar boats. And then finally, when it comes to the other recommendation I have is asking other family members when you need them to step up. And you'd be surprised who steps up. But sometimes they don't know that you need help because you may be seen as strong and capable. So you have to let them know. If you don't let them know, then they may not know to help. So I think not being afraid to say, hey, I need you all to step up. I need this day off.
Wonderful. Thank you, Dr. Gray. We do have one last question in the chat, so I can read it quickly. It says, who is actually coordinating care between healthcare providers? Yes. They say sometimes it appears one provider is in charge when it's actually a different person who has priority. If you could just touch on that for a moment.
Wow. Yes, let me send this one link here. Okay. That is, it varies. That's the short answer. So who is actually coordinating care between healthcare providers? It varies, but I will say that oftentimes family members are the conduit. They're the consistent factor in a lot of this. And that's that's what I like to focus on now is helping family members as patients are moving through different systems and settings. And we're finding that there's a lot of ambiguity. There's a lot of variety when it comes to who is really coordinating care. So being able to make sure that the patient's information is electronic as possible, that way it can flow better through health systems. So having access to their patient portal is important, and also making sure that any results or messages are seamlessly available in the portals. That is just critical. But to answer your question, it varies. There's often not just one person, and there's a lot of miscommunication that can happen in the process. So we have a lot of work to do in that area.
Thank you so much. I think we're about at time, so I think we will end it here. But Dr. Gray, again, just thank you so much for being here and sharing with us your kind of important ways we can advocate for ourselves and for our loved ones with cancer. And again, thank you so much for putting that slide back up. Just as a reminder, we have one more session in the caregiving series. I just put the link for registration in our chat, and you'll also receive it in an email as well. So if you are able to, please join us on November 30th for our last session in the series. And again, thank you everyone so much for joining and really the invaluable care that you do provide. And on behalf of CSC, we hope you have a safe and happy Thanksgiving. All right, everyone.
Yes, reach out with any questions. Thank you all so much.
Thank you all. Take care.